Good morning. I'm Andrew Blustein, the chairman of Garfunkel Wild. On behalf of Garfunkel Wild, I want to thank you all for attending the 12th annual Garfunkel Wild Healthcare Conference. Last year, I joked how excited I was that Anthony Volpe had hit a grand slam in the fourth game of the World Series to keep the Yankees' hopes alive. Sadly, this year, I can make no promise of hope. But we still have the Garfunkel Wild Healthcare Conference. So, yes, this used to be an ASC conference, but as the years went by, we had more and more sessions, which were general in nature, really could have applied to ASCs or not. So, we decided to make it official and expand the conference to a general healthcare conference. ASC people, do not worry. We still have a session specifically for ASCs as Bill Prentice is back again. He's the CEO of the Ambulatory Surgery Center Association, and he'll be speaking at 10:45. And there are also many other sessions which are also important for ASCs. But if you don't own an ASC, I still think it's very important and interesting to listen to Bill's session because I think you'll see the intersection of healthcare, advocacy, and legislation, which influences everybody in healthcare. But the decision to expand was really for two main reasons. The first one I've already mentioned, that the topics are general in nature and can apply to any entity. So, for example, our first session after I'm done is what to do when the payer says no. This will provide insight into dealing with managed care companies. I think you're going to find that fascinating. The panel is top rate. We also have hot topics in HR, which will help any employer navigate ever-changing human resources issues. We have a session on our valuations really bulletproof, when they fail and why. This is a really important session for anyone who's dealing with fair market value issues, buying or selling or employing. The reason why it's very important is because we are seeing that there are some real problems with these valuations, and this should make you wiser on that issue. But the second reason that we wanted to expand is simple. We wanted to brag. We wanted to demonstrate the breadth of GW's practice. From finance to compliance, from bankruptcy to long-term care transaction, GW has expertise in every corner for all participants in the healthcare industry. So for this reason, we have sessions on MSO PC arrangements, HR, banking, restructuring, the OIG, fair market value, hospital investments, and many other topics, all showing that we can handle everything that anyone in healthcare will need. But now that I'm done bragging, it's hard to believe that we've been doing this for 12 years. It's an educational endeavor. We are proud to remain virtual and free. There are no ads, except for us, the one I'm doing now. And it's virtual because while we love to see everyone, we have over 350 people that registered. And it's tremendous, and every year it keeps climbing more and more. So if this is your first time participating, you'll be added to our mailing lists and you will be getting more webinars. We're constantly putting out educational material. One change in our agenda. We have moved our last session from starting at 4:15 to 4:30. Now, if you're listening to a session and you want to ask a question, you can email write this down, get a pen. You can email the questions to healthcareconference@garfunkelwild.com. That's healthcareconference@garfunkelwild.com. And you can also call any of our 6 offices and tell the receptionist that you have a question and to give it to the conference team. And we'll try to get to those questions. If not, we're happy to call you afterwards. And remember, 4:30 is live, and even during that session, there'll be a place to add questions, so hopefully we will see them. In case you don't have your agenda handy, you can, because I think you're going to need it, this is a long day, you can go to garfunkelwild.com, again, garfunkelwild.com, That's our website. You can scroll down um, to topics, and you can click on the trending topics. You can click on the 12th annual ASC Healthcare Conference, and you'll see the whole agenda. In total, there's going to be 12 sessions before our live one. So it's a lot. Feel free. We recognize there aren't bathroom breaks. You may have to go out. You don't have to log back in. You can keep it going, but if you log out, you can log back in. But we tried to create something for everyone on today's agenda, and most of the topics came from people who are registered and listening to this broadcast. Now, last thing before I turn it over to the managed care session, which is going to be led by Deborah Silverman. This could not have happened without many people. This is not an easy endeavor. Our marketing and IT, including Miguel, and our excellent support that we get from the IT department. My partners, Kim Kempton, Greg Bloom, Nicole Gade, who spent a lot of time planning this. Of course, Beth, who many of you have been in contact with, who keeps everything organized and on track, and we thank you very much, Beth, for your coordination efforts. The last thank you, which is really important, goes out to all of our speakers, both at GW and industry experts. You're sharing this information, you're not getting paid for it. Sometimes you're collaborating with other speakers, and you just do it just like us because you have a desire to educate, and that's wonderful, and thank you for joining our mission. Now, thank you to the whole audience for attending today and sitting through all of these sessions. All the registrants, you'll be getting presentation materials. I know we always get questions, are you sending out the slides? Yes, we are sending it to you. And you're also going to get a recording, so if you miss something or you're dying to listen more at home, you'll be getting them and you can listen to them and you'll get it by next week. So with that, sit back and get ready for an incredible day of healthcare knowledge and education. And our first session will start right now, what to do when the payer says no. Thank you, and I'll see you all at 4:30.